Dr. Kirk Eriksen is our special guest from Chiropractic Health Institute, and he is interested in helping people stay healthy, prevent diseases, not only things that affect your spine, but your overall health. And he's going to be talking about some subjects today that you might not think a chiropractor would be interested in. But we're going to talk about why you should stop smoking or either never start smoking. Dr. Eriksen, we were chatting about ways to lessen health risk. One of the best things you can do is quit smoking or never start. Explain.
Absolutely. Smoking is a serious problem. We know that each year more people die from smoking than from cocaine, heroin, AIDS, automobile accidents, fire, homicide, and suicide.
Even the soldiers in Iraq that were killed.
Absolutely. We're talking about over 400,000 people, and also a loss of about $50 billion in work productivity and healthcare costs. You know, the thing with smoking is that it would be easier to list the parts of your body that it doesn't affect than to list the parts or the systems of the body that it does. We know that it clearly affects heart disease, and we know that heart disease kills about 700,000 people a year. It affects cancer, not just lung cancer, but many types of cancer. And cancer,
even in your mouth.
Absolutely. And cancer kills about 560,000 people a year. Stroke kills about 160,000 people per year. So it's a serious issue. Smoking, basically, to simplify things, it decreases tissue oxygenation throughout the body because it affects blood flow, and that affects the oxygen that your tissue needs. And of course, that leads to all sorts of diseases. There is other things that it affects that doesn't kill you, that makes you look like you're dying or makes you want to die.
And one thing that is helping women stop smoking more than all those other health risks is their faces age so much faster.
Absolutely, and you know, there is a slide here of a picture of a computerized image of someone that looks young in their 20s that actually has been how they're going to look when they older smoking. And so yes, it does affect you, cause you to look older prematurely. Now these young teenage girls that want to smoke because they think that they're mature and they're sexy, well, you know, the picture that you'll see in a minute is really what's going to happen. Now what about teenage boys that want to smoke because they think they're cool? Well, we know that men in their 30s and 40s, they have a 50% increased risk of developing erectile dysfunction if they're smokers.
And if they've been smoking earlier, it even gets worse.
Absolutely. So I don't think that's a very cool thing.
So girls don't want to look ugly and men don't want to lose their ability to enjoy sex.
Absolutely. So what can we do about it? Well, we need to quit, and it is a tough thing to quit. And if you've tried to quit, keep in mind that the average smoker who successfully quits smoking fails 4 to 5 times. So if you've tried and you failed, keep trying. Now keep in mind, what you have to do is you have to start somewhere. You got to make up your mind that you want to quit. And when you make that decision, set a date and change your environment. Get rid of your ashtrays, clean up your car, tell all your friends you're quitting, make sure they hold you accountable, and then get some help. And there's some may want to turn to their medical doctor and get medication, but keep in mind there are some wonderful support services like hotlines out there. For Alabama residents, they can call 1-800-QUIT-NOW and they can get free support. They can talk to a counselor every day if they want to. They can teach you.
It's more addictive, I've heard, than even cocaine or some of the other drugs.
Absolutely. Our former Surgeon General, C. Everett Koop, said that it is as addictive as heroin and cocaine. The National Cancer Institute, you can call 1-877-YOU-QUIT. So there's some great strategies because smoking is very habitual, and there's triggers that trigger people to want to smoke more. So these are things that you need to do.
All right, I think we've got some pictures. I want to see these because they
Yes.
show you the difference in the way a person starts smoking. Now, the picture on the left, tell us what we're looking at here.
Yeah, this is a computer enhancement of a young pretty girl in her 20s and what she will be projected to look like later in life in her 40s if she continues to smoke. So
She'll look a lot older than she is.
Absolutely.
All right, in the next picture, I think we've got one. No, that's
Yes. Well, that's the next thing I wanted to talk about because
Osteoporosis.
another risk factor of smoking is osteoporosis. And osteoporosis literally means porous bones. And the problem with that is it leads you to increased risk of having different fractures throughout your body. And Osteoporosis predominantly affects women, obviously, and it is something that women, they reach their maximum bone density between the age of 30 and 35. Mm-hmm. And after that, some can lose up to 2% per year from thereafter. Now, that means that before the age of 30, we can do a lot of things that will really impact our future bone health. And what's one of the main things that we can do to prevent this when we're young? What about, don't smoke, but also what about throwing away all this soda? Okay, now why is soda so bad? Well, a couple of things. One, soda has phosphate in it, okay, and phosphate contributes to leaching calcium out of your bones. That thins your bones over time because the average American drinks between 3 and 4 quarts of soda per week, and it's just trash. Also, what happens is instead of drinking milk or other healthy beverages, we drink soda, and that also decreases our ability to get the proper nutrients into our system. Now, what can we do? Well, every week women come to me and they're distressed because their bone density test has come back and they have osteoporosis and they don't want to go on the drugs. And of course, I would never interfere with what their medical doctor is recommending to them, but I can maybe give them some other suggestions of things they can try. But the problem is many of them wait too long, and it's too late almost. But we know that several things. Of course, you got to get calcium supplemented into your diet. Vitamin D is also important in your body's ability to absorb calcium. We are finding out more and more about the benefits of vitamin D and its ability to help reduce risk of cancer and all kinds of health problems. You can talk with your healthcare provider about what type and how much vitamin C you need to take. But there's other things too. For instance, high intake of fruits and vegetables has been shown to increase bone density. And this is something that has a plethora of health benefits, which we've talked about in previous shows.
Antioxidants and make your skin better and just
absolutely. And I've talked about the supplement that I take, Juice Plus, in the past.
And Juice Plus has been recommended by so many professionals.
Yeah, there's so much research on that. But also, exercise is very, very important because stress on bones has been shown to increase bone density as well. Exercise has been shown to reduce your risk of some cancers, help you live longer.
And it helps avoid depression too. It puts those endorphins or whatever back into
Absolutely, and you bring up a very good point because going back to smoking, the nicotine in smoking, which is the active ingredient that you get addicted to, is a very powerful antidepressant. So if you're going to take cigarettes away from yourself, you got to do something to counteract that. So vigorous exercise, as you said, has been shown to be as effective or more effective than taking drugs for mild to even moderate depression. So it's a very wonderful thing. Stress. We talked about stress on your bones and how healthy that is, and that's why you have to do weight-bearing exercises. But what about bad stress?
Yeah, you got a picture. I don't know who still got it, but a lady pulling her hair out. I felt that way.
Yes.
There she goes. It's not good for your hair either.
That's right. But you know, the CDC has said that up to 90% of, it's been estimated that 90% of the visits to doctors' offices are contributed in some way due to stress in people's lives. And you know, the bad thing about chronic stress is that it causes our bodies to release adrenal hormones, which increases your blood pressure and your pulse rate. And that's a problem because that's like putting yourself in a fight or flight syndrome, which we've heard that statement before. You see, God created us to live in a different environment. We were originally designed to live in a more of a wilderness with wild animals that could hurt us. So we have this built-in system that if we sense danger, our heart starts pumping and pumping blood into our muscles so that we can run away, we can react. And that's a very healthy, very important function. But stress does the same thing. So what happens is some people are living under this chronic low level of a fight or flight syndrome, and that damages their body in so many different ways.
So ways to decrease stress is exercise, not smoke.
We can do simple things. We can turn off the TV. We learn to say no. As a matter of fact, I recently turned down a book contract to write a chapter in a pediatric book, which I normally would have accepted that, but I knew that it would, because of this other book that I'm working on, it would be too much on me.
You don't overload your system.
You need to simplify your life. You know, work on your relationships. That helps too. Work on your debt situation. That helps tremendously. Your prayer life, very important. I love that famous prayer. God grant me the serenity to accept the things that I cannot change, the courage to change the things that I can, and the wisdom to know
To
the
know
difference.
the difference.
Absolutely.
Now we don't have time to go into it, but you have been doing a study following patients with changing their lifestyle. And you also give free health tips to people, which are wonderful, not only in chiropractic care, but these things that you've been sharing. We've got the information on the screen. Can we give that to people? You can call him if you need a checkup. Dr. Kirk Eriksen, Ways to Lessen Health Risk. Here's his website, www.chirohealthinstitute.com. Or if you want to email him, Dr. Kirk, here it is on the screen there, and also his phone number. Our special guest, Dr. Kirk Eriksen.